Hi, I am Alondra Lozano, and this is my oral surgery class presentation on the topic the importance of patient safety and safe surgery. Introduction. Quality and patient safety in surgery are not unknown concepts in the health science. Although intend to standardize methods, techniques, and criteria in order to reduce errors, bypassing complication or adversity, surgery is a science that is constantly changing and updating, representing a challenge for those involved as clinicians, professionals, technicians, and ultimately valuable resources and facilities on several occasions not have ideal characteristics or budgets to optimize conditions in the development of a model for safe care in oral surgery. One of areas of greatest opportunity for improvement is a particularly careful assessment of clinical cases, investigating factors that allow warrant surgical difficulty and potential complications, admitting planning constants to each for difficulty and potential complications, admitting planning of the upright that could represent this event allow the reduction of time and facilities decision making. What is oral surgery? Oral surgery is a specialty within dentistry that address problems related to the teeth, gums, jaw, and other oral structures. Surgical procedures can range from simple extractions to more advanced procedures that require detailed planning using imaging technology. Patient safety objective. Patient safety aims to reduce risk and prevent avoidable harm during medical care. In dental surgery, it is vital for avoiding errors, preventing serious infections, protecting critical anatomical structures, and ensuring high-quality treatments that maintain patient trust. Patient safety protocols. The implementation of strict protocols drastically minimizes complications and adverse events. Checklists adapt, adapted from the World Health Organization model, it allows for the verbal confirmation of the patient's identity. The procedure to be performed include the site, allergies, and the proper functionality of the equipment before beginning. Infection control. Rigorous use of biosafety measures, sterilization of instruments, and disinfection of surface to prevent healthcare associated infections. Preparative evaluation, a complete medical history to identify systemic risk, hypertension, diabetes, coagulation disorders, or hair problems, and a thorough review of radiological studies to avoid damage to nerves or maxillary sinus. And pain management and sedation, safe administration of local anesthesia or sedation with vital signs, monitoring equipment, oxygen saturation, blood pressure, and a plan for responding to medical emergencies. Predictive risk factors in oral surgery. A comprehensive assessment of the patient's health status will allow us to identify systemic factors such as diabetes, hypertension, and ischemic heart disease that could trigger a medical emergency or an accident attack. At the same time, it enables us to identify the various medications used to treat these conditions. This allows us to review in advance any potential side effects, adverse reactions, or drug interactions that might arise. Factors associated with immunosuppression that pose a risk of infections such as malnutrition, diabetes, renal failure, HIV, heaven smoking, etc. A careful analysis of clinical factors including limited mouth opening, difficult accessing the surgical site, age, history of root canal treatment, temporomandibular joint disorders, small mouth opening, loss of coronal structure, skeletal type, and associated mental thickness that might cause trauma to adventices. A thorough evaluation involving radiographic analysis with appropriate instruments, thanks to new technologies, allow you to observe nerve contact of proximity, changes in root morphology, bone dendricity, internal resorption, fractures, associated pathological lesions, root canal treatment, and an increased number of roots. This will enable us to determine the necessity and approach for odontosection and bone windows, as well as to identify risks such as paresthesia, fractures, or damage to other structures. Patient management. Oral surgery can cause anxiety in the patients, so it is essential that the surgeon instill confidence and explain each step of the procedure. One, communication. Explaining the procedure clearly and simple helps reduce fear, allowing the patient to rest or express their needs during surgery improves the overall experience. Two, premedication. Antibiotics are administered before surgery to prevent infections. And three, pain management. The patient receives pain medication at the office to prevent any discomfort once the effects of the anesthesia wear off. Prevention of local complications. Safe oral surgery not only prevents general damage but also specific anatomical complications such as one, nerve injuries like inferior alveolar nerve, which can cause paresthesia. Second is the oral sinus fistulas. In upper molar extraction is most common because this is more um, near to the sinus, and emphysemas caused by improper use of rotatory instruments. And this is examples of nerve injuries, oral sinus fistula in a 1 molar upper, and emphysema. And thank you for watching.